All right, I lied. I guess that something else happened. So I'm back. So let's see what's going on. Wait for everybody to jump back on here. Wait for everybody to jump back on. Jump back on. Jump back on. Yo, hey. So, change of plans. I'm back. So my plans that I had scheduled they kind of fell through. So here we are. We're back. We are back. To get everybody to jump back on. How y'all doing? Hey, I'm back. I'm just waiting for everybody to show back up in here. Just waiting for everybody to show back up. Show back up. Invite another host to go live together. Man, I should start doing that with Nurse Nelly. That way she could, But then again, she might be off cooking right now. So shout out to everybody that's jumping back in. Shout out to y'all for jumping back in. I had plans, but those kind of fell through because somebody just got into an accident and they had to leave. So I was like, you know what? Should I jump back and do a live? I think I just, keep doing the live probably for like another hour or so. See what's going on. So I'll just wait for everybody to jump back up in here. How y'all doing? Welcome back to the stream. And if you weren't in the stream, I don't know, like 5 minutes ago, yeah, we're back. So just waiting for everybody to jump back up in here. How y'all doing? Hey, so if you guys is this your first time here at the stream? Welcome. My name is Kevin. I go by the Boot Nurse. We're going to be talking about, nursing, NCLEX, pre-nursing stuff, essentially whatever you guys want to know. So I want to know who you are, where you're from, where you're at in your nursing journey, and what questions you guys have. So that's essentially what we do every Monday, Wednesday, and Friday between 5 and 6. And my co-host, she's not here yet, but if you guys are just now joining, I was just streaming for about 30 plus minutes, and then I had to get off because I had something that I had to do at 5:30, but I couldn't do that because there was an emergency that came up for that individual, so I have to reschedule that. So I was just like, let's jump back up in here. Let's jump back up in here and see what's going on with everybody. Hello, how are you? Is that Ali? So, yeah, well, thank you. Thank you for welcoming me back, Jimmy. I appreciate that. So like I was saying, like I had, something planned to do at 5:30, and that kind of fell through because there was an emergency that happened on that individual's part. So I was like, you know what, why not? Let me just jump back up in here. So hi, I'm from New Jersey. I'm 48 years old, and I just got accepted into a nursing program. Pray for me. Hey, is that Yanira? Yanira? Is that how you say your name? Yanira? That's a nice name. 48 years old. Once again, your age hasn't. First of all, I said Yanira. I ain't saying nothing about Siri. You see, Siri just doing what she wants.
I don't know what that means.
Siri.
If you like,
hush.
You can search the web for. I say nothing about Siri.
Yo, Siri out here acting out of pocket. I don't know what the hell going on, right? So, but first of all, you being 48 has nothing to do with you going to school. Number one. Number two, I am definitely going to pray for you going through your nursing program. But that's a journey. You journeyed all the way through through the prerequisites. You journeyed through the entrance exam. Now you're about to journey through the actual program, and you're going to do just fine, just like the rest of us. So, I'll pray for you. I'll pray for you. You're going to do all right. Yeah, I know you did all those prerequisites. I'm just saying, it's just like you're gonna do all right. A lot of my nursing friends told me that nursing school, you don't learn anything, you learn everything. It's kind of like you go like I wouldn't even necessarily say that you learn everything. You just become familiar with just about everything. Like some people don't retain the information, and especially at the speed that nursing school is. So at least like when you get to a certain part of nursing school, you can't say that you weren't exposed to it because the curriculum shows that you were exposed to it. So, on the job, is that true? Yeah, you learn everything on the job. You take the didactic aspect and, and then the practical aspect is where it just sinks in. That's exactly what it does. So that's 100% true because we can learn everything in a nursing book all day long. But until you actually, put brain and hand to patient, it's not going to matter. I'll give you an example. I knew everything about in a book for a patient that would get sepsis. I would know what their vital signs would look like, so on and so forth. but when it happened, when you were exposed to it in real life, especially if it's your first time and you're just like, yo, like, what do I do? Like, I can read this in a book all the time, but if I can't put hand to patient, especially if you weren't exposed to it, it's a very real thing. And it actually happened to me. And when it happened to me, it was just like, I kind of froze. It's because, okay, I know all of these things, but I haven't been exposed to this type of patient before. And then that's one of the other reasons on why I left the ICU. I have a video ready for that, but I just haven't put that out yet. And I hate editing on my phone, but it's on my phone and I have to edit it. And I'm trying to think to myself, damn, do y'all going to sit here and listen to me talk about why I quit the ICU in a 10-minute video? Damn right you are. You're right. You sure are. So, what is that? Sylvia said, thank you. You're welcome. Jimmy said, thanks. Because everyone told me not to stress school, just graduate. I didn't know what that meant. So, not saying that you don't want to stress school. It's just like, you do want to pay attention in school. You do want to get the knowledge and you want to acquire as much as possible. But the real world is very much different from the actual book. So like you get the basics and the fundamental thought processes and the nursing process and all that stuff while you're learning in school. But then everything everything comes together from the learning and the hands-on while you're when you're working. So I start September 7th. The classes I'm taking are Pharm Fundamentals and Math. Any tips? You start your are you taking these classes and you start school on the 7th and you take those 3 classes. So my tips for you would be, once again, if this is your first time here, I don't know why you're not following me. That's number 1. Number 2, you need to put yourself on a schedule. And so fundamentals is the basics of it's the basics of the basics when it comes to nursing. Like, the nursing process, why we do what we do, the history, all that good jazz. And then, basic care and comfort. But the biggest thing about fundamentals is understanding how to provide safe nursing care to a patient. So once you get that thought process, is like, okay, I need to know how to perform, safe things, as a nurse, medical administration to patient positioning, what certain things look like, like wound care, like certain wounds and different stages and stuff like that. Those are the things that you need to know for fundamentals. Math is usually like dosage calculations. And those are simple conversions, but you need to know like what that formula is, as well as, changing a decimal to a fraction, or, micrograms to milligrams, or milligrams to grams, like knowing those and what those conversions are, because, everything is done off of the metric system. So, you got to do pounds to kilograms, and then how to apply those towards your patient, because, what are some of the most important things when prescribing medications to a patient? Age is one, weight is another, right? And they based all medications based off of the weight when it comes to giving medications. Okay. Let's see what's going on. For pharmacology, it's know where that medication falls under, the family name suffixes, right? So as I explained this earlier, you weren't here, but I, know the family, know what family it falls under. Is it a cardiac med? Okay, cool. Under the cardiac medications, which suffix sticks, or which one is it? So is it an ARB? Is it an ACE inhibitor? Is it a beta blocker? Is it a calcium channel blocker? Is it digoxin? Stuff like that. Okay, now under, ARBs or under calcium channel blockers, what are the suffixes that end? So is it like a LOL? Is it a PRIL? Is it a statin? Which one is it? Once you understand where they fall, you'll be able to understand what they do, if that makes sense. So you can't come up to me and be like, hey, lisinopril is a medication for gastrointestinal issues. I'm going to be like, wrong. It is not. So once you understand the families, the family names, the suffixes, and where they fall, you'll understand what they do. You'll understand the signs and symptoms, and then you'll understand when to give it and when not to give it. Once you if you start to follow that pattern, you'll almost always get medications right. Lex said, any med-surg advice starting next Tuesday? Here's one thing I would say about med-surg is, and I say the same thing about fundamentals, get into a small group and no more than 4 people to include yourself. So you and 3 other people, and split the notes up. So med-surg, if you're doing med-surg 1, it's like the first half of the book. So, you're going to be going over what the cardiac system, the nervous system, endocrine, respiratory, whatever. You know, like if you know you're going to be studying for these tests that are going to have like the cardiac, the nervous, and the respiratory system, you know, find other people that, you know, that are in your class that you're cool with. You know, form a small group, split up total those sections 25. And then at the end of that, you all exchange notes. So that way the whole thing is taken care of. And then you can compare notes and then you can study together. You'd be very, very surprised. I'm telling you, you'd be very, very surprised on how well that could work for you and how much time that could actually save you in stress. Peds nurse, appreciate you. Ali said, thank you. You're welcome. Find someone like Kevin to study with. Look. Sometimes, most of the time, okay, all the time. I'm usually one of those people that'll really bring people back on track. I'll be like, all right, cool. Like, let's not do that. Because if you start to bring up a subject, you know, like I'll be like, all right, cool, let's talk about it. And then I'm like, all right, cool, let's do some questions. All right, let's dive a little bit deeper into it. But then you want to start talking about the weekend. I'm going to be like, man, let me tell you what I did the weekend. And then I'm going to be like, whoa, let's not do that. I'm the type of person that'll rope us back in. So sometimes, not all the time. But I appreciate your enthusiasm when it comes to studying. I'm just saying. So Lex said, thank you. You're welcome, Lex. For those 9 people that are now in here, if you're new, make sure you guys follow me. But once again, if you're new, my name is Kevin. I go by the Boot Nurse on all social media platforms to include YouTube, Instagram. I have a Facebook page also. It's called the Boot Nation Facebook page. You guys can go over there and check that out. It's for pre-nursing students, nursing students and nurses alike. We're trying to foster a great positive community over there. And, you know, any questions that you may have, you know, we're trying to foster all that. And we're trying to make sure that, you know, we want to try to change the narrative in regards to what's going on, you know, like in the nursing field, like from the beginning. Like I'm one of those people where it's just like, I believe that if you get a child from the beginning and you raise them properly, the 9 times out of 10, they are going to be a great product of society. So I'm just like, if I grab a pre-nursing student right now and then I guide them all the way in some way, shape or form, that they will be able to be a positive nurse when they get out here into the field. And I mean, most people will agree with me. Other people are just like, oh, well, you're not going to, I mean, at somewhere, somehow, then, you know, the narrative for all that has to change. Okay. So like I said, I got that Facebook page over there. If you're just now starting nursing school, and you want to get a jump start on your NCLEX review or an NCLEX course, check out the 7-day NCLEX course. The link is in my bio. You get it for $48, which is 80% off the current price right now. It's in its pre-launch phase, so I'm going to be updating content all the time. As a matter of fact, I'm working on about 8 or 9 subjects right now, specifically for pharmacology, to follow with next generation NCLEX style study guide as well in there, and they're all video based. But once you get it for $48, you get it forever, you know. So, and you get all the updates and all that good jazz. So make sure you guys check that out. Link is also in my bio. But I want to know who you are. I want you to look deep within yourself and tell me who you are, where you're from, where you're at in your nursing journey. So you're a pre-nursing student, you're a nursing student, you're about to take the T's, the HESI. Have you taken your NCLEX? How many times have you taken your NCLEX? Are you a nurse that's already working in the field and you have, you know, something great to give us based off of your experience? Yeah, let me know. Be picky about your study groups. I would agree. You definitely want to be picky about your study groups because you don't want to be in your study groups where you have a bunch of people talking about stuff that doesn't matter. That's, you know, first and foremost. The next thing you want is that you want to have somebody in your study group, of course, somebody that you vibe with. You know, you're all going to go through the same struggles and the same troubles while you're in nursing school. So, you know, but then you also don't want to be around people that are just negative, that are all the time saying, you know, fuck this test or fuck these people or blah, blah, blah. I was in school with a girl who was like that. And then when it came to the second semester and she was screaming for help, nobody was helping her because she was rude and disrespectful. And when people were asking for simple help in the first semester, she was just like, I figured it out, so you need to figure it out. Probably not the thing that you should say to, you know, a bunch of people who are going through the same struggles with you, because what happened? She was struggling the second semester and was failing her exams and nobody wanted to help her. Nobody wanted to share notes. People ignored her. So don't do that. And the same thing goes from when you actually start working as a nurse. If you're that nurse that's an asshole and that's not approachable, you know, people won't fuck with you. Like, you need help turning your patient, they're not going to help you turn your patient. You know, like like, I know that sounds shitty, but that is the truth, you know? And that's just kind of how it rolls. So I'm just keeping it all the way honest. You know, not saying that you have to like everybody, because you're not going to be everybody's cup of tea. I know this is hard to believe, but I am not everybody's cup of tea. Let me tell you right now, because a lot of this comes out, a lot of that, you know, like it's real, like kind of like in your face, and some people are not with that vibe, and I can understand that. But most of the time I'm just like, hey, I just need help, just turning. You know, here's a funny story. When I was working in the ICU and I was trying to clean a patient. There was this nurse I never saw before. She had poked her head in the room, and I was just like, hey, can you help me turn her real quick? And she flat out said to me, sorry, I don't work here. And I was just like, I didn't ask you if you worked here. I just asked if you could help me turn her. Like, you don't need to do anything. I just need you to help me turn her, because this lady weighed like 300 plus pounds. I just need for you to help me turn her so I can clean her. And then she was just like, yeah, hold on. And I was just like, are you kidding me? Like, I don't even know you. So now when I see her visually, I'm just like, you know what? I owe you one. But don't ask me for nothing else ever again, because it's just like, I shouldn't have to beg you to help me turn this patient. You know, like, be cordial with everybody, but I know that, you know, you're not going to be everybody's cup of tea, and that's okay. Fancy Girl says, agreed. Never too early to start thinking about NCLEX. I wish that I would have actually just known about what the NCLEX was before I started school. Even at the beginning of nursing school, no one's thinking about NCLEX. You're thinking about those first tests that are coming through. I didn't start thinking about NCLEX, I kid you not, probably until the spring semester that I was graduating. So I graduated in August of 18. I didn't start thinking about NCLEX maybe until about February or March of that year. So, I mean, it's a very real thing. So if you can get a jump on it now, I'm just saying, link is over there. Facts. I hear you. I'm just saying. Agreed. MARN. Right. Agreed. Oh, I guess that's what you're saying. Like, what? Oh, I'm an RN. I'm tracking. Agreed. I'm an RN in a trauma center, and these pets are lazy. These peeps. I got you. Heather, you got to slow down. You got to slow down with the fingers. Like, you got to slow down. But Jade said, nursing student here. I wish I would have started NCLEX practice in my pre-nursing. So now here's the thing I'll say about pre-nursing. Now, you won't understand so here's the thing, is that you won't really understand what NCLEX is until at least you get into your first semester, at least until you do fundamentals. Because at that point, you're going to be like, I don't understand what these questions are asking me, because you don't have context to apply it. Right. But once you get through fundamentals, you're going to be like, OK, I at least know a little something. I'm at least now familiar about what I'm seeing. You know what I mean? So once you're in through fundamentals and you learn about ADPI and, you know, the nursing process, you know, basic care and comfort, reducing infection, wound care, you start learning all the, patient or medication administration. Once you start learning about all those, I'm going to say little, but once you start learning those things and you at least have seen it and been exposed to it, then that's when the NCLEX questions and the NCLEX stuff, it starts to just be like, oh, okay, this makes a little sense. Now, if you're doing pre-nursing stuff like A&P, doesn't really matter. Or if you're taking micro, it doesn't necessarily really matter, right? Because they're not going to be asking you those caliber of questions. You know what I mean? So, but definitely around fundamentals, or at least after fundamentals, you at least be like, oh, okay. Because then the caliber of the questions are going to make somewhat sense to you. So it's at least familiar, if that makes sense. I hope that makes sense. Devontae says, any advice on patho? Look, so patho is actually one of my favorite classes because it's the disease processes and how it affects the body, right? The best, honestly, like I can't even like, let me see how I can articulate this. So for example, you learn about, we'll talk about diabetes, right? So you learn about diabetes, and what is encompassed in regards to diabetes. So when, at this point, I was using flashcards or note cards, and then I would put, I put diabetes mellitus or mellitus or however you want to call it, type 1. And then on the back, I would put what the definition of it was, how it's caused. So like, type 1 is essentially like you're insulin dependent, and that's talking about what? Certain organ not producing certain what chemical, you know what I mean? Or if type 2 is just like certain organ produces what chemical, but not exchanged because of X, Y, and Z. You see what I'm saying? So like once you get that thought process of, cause and effect, That's that to me, that was the easiest way to study patho. Alicia said, hi, I'm starting nursing school in the fall. Any tips for funds and farm? So for funds, well, I already said this for farm, learning about family names, suffixes, and I use cardiac meds. I'll go back and I'll say this again. You need to know, which one's a cardiac med, which ones are your gastrointestinal meds? What are your respiratory meds? So now that they fall under those families of those, those areas, okay, now I need to know what category does it fall under? Is it a ACE inhibitor? Is it an ARB? Is it a calcium channel blocker? Is it a beta blocker? And you know what those are based off of the suffixes, like the last part. So LOL, pril, statin, stuff like that. And then once you learn about what those do, what are their effects? What do they do? Do they lower blood pressure? Do they lower heart rate? Do they increase cardiac afterload? Do they decrease cardiac preload? And then once you hit that family of cardiac meds, they usually all have the same types of signs and symptoms. Usually, but this is why you go through them and you're just okay, this lowers blood pressure, so I'm going to be thinking about orthostatic hypotension, right? Or, digoxin has a narrow therapeutic window, so I could possibly cause, any type of, cardiac dysrhythmias, if they give too much or if they don't give enough, you know what I mean? So that's how you would know, for farm. But for fundamentals is just fundamentals. It's all about learning the nursing process. All about learning the nursing process. I start fundamentals in 2 weeks. I'm so nervous. You ain't got to be nervous. Just go and hit it hard. Hardest class in nursing school. For me, the hardest class in nursing school was pharmacology. That was by far the hardest class for me. I loved patho. I didn't like fundamentals because I had already had a lot of medical experience working as a hospital corpsman in the Navy, and I was a surgical tech, so I was very understanding of the fundamentals. But my issue was that I couldn't turn off corpsman and turn on nursing student because I thought I knew everything. And then when I got to fundamentals, I almost failed it. So I had to stop and I had to unlearn everything I had learned over the last decade, and then I had to relearn essentially something new. So nursing school is all about the why, not necessarily the how. I can teach you how to do an IV, but I need to know why, when I'm doing an IV, why I give these specific fluids or why I give blood. What will happen if I give too much blood? What happens if I don't get enough? What are the side effects if they start to have, some type of issue with blood? Based off of the issues, what are the different issues that you can have in regards to blood transfusion? You see what I'm saying? So it's stuff like that. But pharmacology was definitely it for me. I failed my NCLEX in June. Is that S.J. Briggs? You failed your NCLEX? All right, so I think you're new here. First of all, if you're new here, I need for you to follow me right now. Make it happen. And as a matter of fact, I want 1,000 likes. Make it happen right now. I love you. So you failed your NCLEX. Cool. I'm gonna sit here and tell you why. Why do you think you failed your NCLEX? Did you look at your breakdown? I don't have my breakdown anywhere. I usually have one of my breakdowns. And you guys may hear my demon of a son start to stick his little grummy little fingers under the door. He'll start talking to me. I don't know what his problem is. He thinks he runs this house, but he doesn't. So you failed your NCLEX. I'm going to ask you why. I don't coddle at all. And so I'll ask you, okay, why? And then I'm going to ask you, what are you going to do to fix it? And I need for you all to remember, and this is on a grand scheme of things when it comes to you as a person, everything is your fault. Now, the next question after that, when you say everything is your fault, how are you going to fix it? How are you going to fix it? Add pie, a delicious pie. Yep. What kind of pie? Apple pie? Strawberry pie? Whichever. Jade said, you're exactly right. It's applying the knowledge to the questions. 100%. Devontae, thank you so much. You're welcome, sir. Nina Rose, I have my nursing process test tomorrow and I'm stressing. Don't stress over it. Don't stress over it. Because if you've been studying for it, you're going to do fine. If you've been studying for it, you're going to do just fine. Alicia said, thank you. You're welcome. Did you attend in person or online? User 2, I'm just going to say 8-2. User 8-2, I went to nursing school all online. My prerequisites were all done. They were hybrid, but all of my nursing school was online except for when I had to do orientation, checkoffs, my first, orientation, checkoffs, and then that was it. The rest of it, all the clinicals were done at the local hospital. So, did you like pediatrics? Peds was okay. Peds was okay. I'm not a big fan of little people like that. But Peds was okay. Oh, yo. Hey, shout out to my bodyguard being in the chat. Hey, Nurse Cass. Hey, Cass is here, y'all. I just want to let y'all know that she's one of my goons. All right. She's been a nurse for a long time. Corrections, working psych. So I'm telling you right now, only thing that's going on in my head right now is Nuck if you buck. I kid you not. All I hear is Nuck. All I hear is Nuck if you buck in my head right now, just for the simple fact that she just came in here, right? So, I'm just letting y'all know that she's a well-known nurse in my chat, and she will answer any questions that you guys have. So, because I freaked out. Well, don't freak out. Yo, what's up, Toy Pod? My man Alex, what's up with you? Moody, okay, so I have taken A&P 1 and 2 and Farm, but I feel like I didn't retain any of that. Any of it. I'm applying. Well, that'll happen because it goes so fast, right? This is why you have those refreshers when you're starting to get. Hey, this is for Cass. So every time she comes into the chat, this is what she gets, because she will fight everybody. Patients, other guards, other nurses. If she's precepting you, she'll fight you. All right, enough of the nonsense. Oh, hey, I'm not gonna lie, that's hilarious. Hey, but back to Moody. You may not feel like you retained everything because nursing school just goes so fast. But this is where, especially when you're studying for NCLEX, you have to go back and you have to essentially refresh yourself on what you were already familiar with. Okay, I had the worst anxiety this morning. Decided to study at 3 a.m. Okay, so let me ask you this question: what's the difference between studying, what's the difference between studying, all the way up to your exam versus waking up at 3 o'clock in the morning? Nothing. Like, you waking up in the morning to study at 3 o'clock in the morning will do nothing for you but increase your anxiety. The way to combat your anxiety is to recreate what your test would look like, or recreate your testing center or the atmosphere, and then apply that. That's for you, Briggs. And hopefully starting nursing school in the spring, and I'm scared. Do I need to restudy for it? No, you don't need to restudy for it. You don't need to restudy for it. There's no, Moody, you don't need to restudy for anything. Like, if you passed them and you did well, you don't need to restudy for them. Because guess what? When you start learning about pharmacology and applying medications in a safe manner as a nurse, you'll be very surprised on, oh, that makes sense. Basically, how much will I actually need to know from the prerequisites? Honestly, like, A&P, like I said, all the prerequisites do is make you familiar. That's it. I'm also taking physical assessment. How was it? So physical assessments you're learning from head to toe, like what you're looking for in regards to your patient. What's up, Bet? Ali said, just saw your video on why you left the ICU. It was hilarious. Hey, you're welcome. Guys over here, like, hey, shout out to all my nurses. Hey, so Toy Pod, I just want to let y'all know, he and I, this is my man's Alex. He's an OR nurse, by the way. He's been a nurse for a while. He and I were actually stationed in Florida together when we were in the Navy together. So he's out here doing big things. And I think, Alex, you just had a baby, right? Hey, shout out to you for having a baby, boy. You know what I'm saying? So it's Iman. I just got below pass on my physiological adaptation, safety, infection control, and management of care. So management of care management of care is the largest section on the NCLEX. From the 8 sections of the NCLEX pie, management of care is the largest section. Physiological adaptation is the third largest section. I'm sorry. Pharmacology is the third. So out of those two heavy hitters, that's probably the reason why you were unsuccessful. So now, what are you going to do about it? Oh, we actually had a code today, and I thought about fighting people. Cass, what's wrong with you? What does it say? Is that said Lin Shungu? I hope I'm destroying that. I'm sorry. Hi, which schools are good for an accelerated nursing? It all just depends. In reality, it all just depends on where you are and what school is there. Like, I live in Texas. They have a lot of accelerator programs. I'm just going to tell you right now, for all 20 of you guys that are in here, or gals, number 1, you better make sure you're following me. Number 2, you better make sure you share this so other people know. And number 3, I need like 400,000 likes. If a Roomba with a camera can get 1 million likes, I should at least get 1,000. You know what I'm saying? Don't make me send Cass after y'all, okay? You already know she got a theme song, and you know she'll fight you, okay? I appreciate you. I love you all. But anyways, It all just depends on what school you want to go to. And I can tell you right now, all nursing schools suck. It doesn't matter where you are. Like, all nursing schools suck. All of them. Like, I hear they get better when you're going for a master's degree. But nursing school, like LPN, LVN, RN, they all suck. Like, every single one of them. So, well, when it comes to an accelerator program, that all just requires the research on your part. So, academic writing, again, it's simple. Due to people like us. Yep, GPA is important. It sure is. Your GPA is important to get into nursing school. So the higher your GPA, the higher chance that you have of getting into nursing school. When I got into nursing school, I think I had a 3.6 or 3.8. I can't even remember because it's irrelevant at this point. But then again, I've seen people get C's and get into nursing school. So 9 months. Thanks, bro. Hey, my man's about to have a no, got it. Look, that's what I'm talking about. Shout out to the babies out there. Congrats to you, my mans. Congrats. Ali said, can you work in the ICU with just an associate's degree? Your degree has nothing to do with you working in the ICU. They want to see that you have that license. And the answer is yes, you can work in the ICU as an associate's degree RN. We help you check the instructions and proofread your nursing assignments. How long would you say someone should wait to go back to school to get their BSN after getting their ADN? There is no waiting period. You can just go straight to go get it. And it all just depends on you. Look, when I got my bachelor's degree, when I got my BSN, I was like, bro, I ain't going to school for a long time. That was 5 years ago. Like August 5th or 4th. I can't even remember now. I think it was the 5th. It made 5 years since I've been out of school. And it was just around the last couple of months where I was like, yeah, I'm going to go back for my master's degree. But then I really didn't understand. I really couldn't differentiate if I wanted to do informatics or if I wanted to do education. And I decided I wanted to do education. And that was just recently where I was like, yeah, I'm going to do that. So yes, it's Shona language. Oh, okay. I got you. Bet and will. We're giving you likes. I appreciate it. I appreciate all the likes, all the love. Just joining in. Welcome. Nuck if you buck. Every time I see her name, I think, oh, that's what I'm trying to say. Cause I'm trying to tell you, she a goon out here. Be trying to fight folks. You're smart. Oh, I don't know about smart. I feel like I'm a little bit more informed, and I have no problem telling people about it. Just like when people ask me, hey, what's your experience in working in a hospital? Everybody's experience may differ. Some people may like it. Some people don't. Some people may like it and some people do. I can tell you right now, I don't like working in a hospital. I don't like bedside. I think bedside is ghetto. Is travel nursing great? It sure is, because the money is fantastic. These hospitals don't give a shit about you. But if you want to move up in the hospital ranks, that clinical ladder, so you can understand what it's like to work bedside and then be in charge and then be a manager and a director, like, those are great opportunities for you. Like, no one gives a shit about their benefits, because I can go to any insurance company and buy their benefits just at around the same price, if not cheaper. Like, you have a nursing license, whether you're an LPN or an RN. You can do so many things with that license that don't even have to do anything with patient care. You know what I mean? And that's something that nursing school will not tell you, that because they want you to go to bedside, right? And there's nothing wrong with that. Just like nursing school says, everybody should go to med surg. I'm pretty sure Castle's be like, everybody got to go to med surg, or they want everybody to go to med surg, but you don't have to go to med surg. You can go straight to labor and delivery if you want to. You can go straight to peds. You can go straight to ICU. You can go straight to the ER. Gone are the days to where you have to go to med-surg. However, is it recommended that you go to med-surg? Most people say yes. If you don't know where you want to go, med-surg is a good spot to go, because then you can kind of figure your life out while you're learning your time management and your skills and, applying your critical thinking in the med-surg setting. There are so many ways to skin this cat. So many ways. Cass says, hell, if I even seen LPNs working in critical care, I've seen, yeah, exactly. Like, I've seen LPNs work in critical care. I was told my AMP in college algebra is 5 years old and they want me to take it. I just want my RN. Well, so depending on what state, like I know in Texas, like they require you to have your sciences. Last I checked, it was 10 years. Last I checked for Texas, if you wanted your sciences and stuff like that, had to be 10 years. So it all just depends on what state or what school it is. I'm going into peds next month. Any advice? Usually with peds is encompassed like with maternity. So like labor and delivery, postpartum, newborn, You'll go to like the pediatric ICU, like the pediatric step down. Realize that their numbers are different. Realize that, their numbers are going to be relatively higher, like a higher heart rate, higher respiratory rate, stuff like that. When it comes to labor and delivery, know that you're taking care of two patients. Two. I don't know why I just did this, but two patients, right? Things are just going to be a little bit different. Peds was a very, very hard section for me, and I had to study that over and over and over. So if you're having a hard time with peds, you definitely want to set aside an extra 30 minutes to an hour so you can study that. I have my MSN in education. Do it. It's the best. Look here, Rebecca. Don't come in here and, throw salt on my game when I'm trying to get. No, I'm just playing. I appreciate you. I've been an educator for the last 8 years. Like I said, I was a surgical tech instructor for about 3.5. I became a master instructor in the Navy. I have my post-secondary certification as an instructor. I taught, a wealth of other programs. I'm also a TNCC instructor, and I don't say this to boast or anything like that, but I say this to let everybody know that you can do so many other things as a nurse. You can do so many other things. So don't you gotta go work at bedside. Gone are those days, and you don't have to always do that. But education, I love being on here. I love teaching. I love everything about it. So shout out to all 31 people on here. If all 31 I need to see 31 shares right now. All 31 of you need to share it. All 32 of y'all now need to get me to like at least 10,000 likes right now. If you don't do it, I'm sending Cass after you. I'm just letting you know. And she will fight you for me. She's already said it. She got into my DMs and was just like, I will knock heads off. Hey, listen. Hey, all right. Don't play with me. Hey, I love y'all. I appreciate y'all. But anyway, shout out to all 31 of y'all on here. If this is y'all first time to the stream, welcome. My name is Kevin. I go by the Boot Nurse on all social media platforms to include YouTube, of course, TikTok and Instagram. I have a Facebook page, Boot Nation Facebook page for pre-nursing students, nursing students, and nurses alike of all ages, shapes, and sizes. We're trying to foster a good nursing environment, where we talk to one another, critique one another in a positive way so we can grow. If you even affect one person, that's all it takes, right? Because even as Big Sean says in one of his songs, one man can change the world. One woman can change the world. And it's proof because there are people that are out there that are doing it. If you're a brand new nurse about to start nursing school and you were trying to get a jump start on your NCLEX, make sure you guys check out the 7-day NCLEX course. The link is in my bio. It's for $48. It's 80% off right now of the original price. It is currently in its pre-launch phase, which means I'm going to be updating content all the time. I'm a one-man army doing everything by myself, so I appreciate everybody being patient with me. But make sure you guys check that out. Once you get it forever. Like, it's there. So if you're a brand new nursing student that's going to be starting nursing school, and you're going to be in school for a year, 2 years, all the way up to 4 years, hey, it's really nice for you to get an NCLEX course with a review and all the stuff that you're going to need by the time you graduate. So make sure you guys check that out, okay? But if you're new, I want to know who you are, where you're from, where you're at in your nursing journey. Are you a pre-nursing student? Have you taken your NCLEX? Have you graduated? How long have you been a nurse? All that good stuff. Let us know down in the comments. I got 25 messages that I got to scroll through. So, and I got a couple. I wish I had my other co-host, Nurse Nelly, in here, but I didn't tell her I was getting back on. But anyways, any question that I can't answer relatively fast, all these other experienced nurses down here will have no problem jumping in and giving you their experience and their 2 cents. Okay. And I'll scroll through, smart, experienced, crazy, and we'll fight straight up. I know she'll fight y'all. Dre said, I'm scheduled to take the HESI next month and I'm nervous. Don't be nervous about that HESI. You're going to be all right. Can some LPNs make more than nurses? I'm telling you right now, one guy that I coached and I mentored, and I still mentor him to this day, he makes like $40-something an hour as an LVN right now in Texas. So he makes more money than me as a staff nurse. I promise you. Todd said, Todd. My man Alex said, I went ER, behavioral health, and now back to the OR. It's kind of funny how that works, bro. Ain't that crazy? Kevin, what are 5 quick tips for pre-nursing students? Do your research on your schools, right? Make sure your schools are accredited. Know what your prerequisites are. Be prepared to cut everybody off in regards to preparing for nursing school. What's some other good tips? When you're looking up your prerequisite classes, use Rate My Professor. And when it comes to looking for prerequisite classes, or when it comes to looking at your prereqs, every school is different. Find a nursing school that has the lowest required prerequisites. There's no need for you to take chemistry too. There's none. There's no need for you to go to that school and take a religious class. There's no reason. Lord of mercy. There's no reason for you to do that at all. Okay. So those are that would be my quick tips. And I just came off the top of the head with that. Georgia is 5 years. Okay. It's 10 years in Texas. I'm back to check in. Okay. What's up, Hudson? I'm eating dinner at the moment. 7 days NCLEX away. Hey, you're going to conquer that. Love our nurses. Thank you all for doing this. Shout out to you. Thank you for this live. You're welcome. Hey, that's what I'm saying. I love doing these lives. I love doing them every single time, which is why I said all 26 of y'all need to follow me. So I better see at least 26 new follows when I get over there. I'm not playing because Cass going to come after you. I'm just saying, listen. All right. So enough of that. I don't know why I keep doing that. It's hilarious to me. I'm a nursing student who needs to hear this. Hey, you're a nursing student that needs to hear this. You're going to be a nurse that needs to hear this too, because just because you become a nurse don't mean you stop learning. That's why I have the term boot nurses, because as a boot in the military, you know nothing about nothing, and you learn. It's a learning process every day, all the time. So as a nurse, you're going to be learning every day, all the time. Even though Cass has been a nurse for, almost 20 years, she's still going to be learning stuff all the time. Like even new, fighting techniques, you know what I'm saying? Try to get her Mayweather on and not get punched in, not get punched in the face. You know what I'm saying? So thank you for educating. I'm a nurse as well, and this is great listening to you guys. You guys will pass in. Yeah, I know that's right. Don't waste y'all's time. I don't know what that means, Rita. What's that mean? Rita, what's that mean? Don't waste y'all's time. Thank you so much. I'll keep this in mind. You're welcome. We gotta go. Okay. Thanks for stopping by. We spit in nursing game and we appreciate you. That's what I'm talking about. I appreciate y'all coming by. Applying this cycle. Wish me good luck. I don't need to wish you luck, Maya. You're gonna get it. Hey, we speak things into existence around here, right? I'm all about words of affirmation. I'm all about putting it out into the universe. If you say it, it shall be so. But you got to put in the work to make sure it happens, right? So don't be screaming. Hey, don't scream out here. Ain't nobody gonna hear you. I'm just saying. First time here. Hey, I appreciate. Is that Fatima Loves Fashion? I appreciate you being here, Fatima. The encouragement, yes. 10 more friends, yes. Next Gen NCLEX review. So I'm actually working on a video that. It's taken me it's like a 3 hour long, 3+ hour recording that I made, or that I'm in the process of making right now with it's a next gen NCLEX review. And it's actually going to be a part of my 7-day NCLEX course, but I'm actually going to chop that video up because no one's going to sit there and want to listen to that video for 3 hours. So I'm going to be chopping it up for anywhere for 15 to 30 minute videos. So that way everybody can get a good understanding of it in the course, but that is coming. It is coming. I promise you it is coming. But thank you for that question. Lexi from Chicago. Shout out to Chicago. Chirac. Look, I was training a new nurse today and I laughed. I automatically thought about you. That's what I'm trying to say. Bailey, hi. How are you? It's the beginning of my LPN program. Okay, beginning of your LPN program, and you're going to, you're going to do so great. Thank you for the rose. Is that a rose? That was a rose. I appreciate you. Thank you for the rose. I don't get roses often, so when I get them, I'm just... Oh my God, that's so nice of you. So I appreciate that. Andrea, pre-nursing student, scheduled for the HESI in September, trying to be an LVN for right now. Let me tell you something. You don't try to be an LVN. You become one. Don't try. Just like off Star Wars. Like what does Yoda say? Do or do not. There is no try. So you need to do the work so you will become an LVN. I need people to change their verbiage up. I need people to speak stuff into existence. I have something on this board right here, and it's not out of reach. It literally says you will make $50,000 in 1 month. I made my own little invisible check up here and I signed it. You want to know why? Because I spoke it into existence. I wrote it and it's going to happen, right? I have all these ideas. Like right here on the left, it says NGN, the next generation NCLEX QBank and how to work that. That's coming. That's going to happen. So I need for you to put into existence of what is going to happen for you. All right. I'm in Maine. Is that Mansfield? Where's Mansfield? I don't know where that's at. Is that like in Massachusetts somewhere? I have an LPN friend that makes $47 working. Look, I'm trying to tell you the guy that I coach and mentor, he makes like $40 an hour. I just want to pass my NCLEX before I lose my mind. Okay. Once again, Iman, I already said it to you. Like, remember, everything is your fault. So how are you going to figure it out? How are you going to get there? What do you need to do for yourself? Fatima, Atlanta, Georgia, senior nursing student at Chamberlain. Hey, so I had a buddy of mine who went to Chamberlain in Atlanta, actually. And now he's a nurse in the Navy right now. He's been a nurse for a while, but he was actually one of the guys I had talked to when I was trying to become a nurse as well. So Oliver and Oreo, Oliver and Oreo, shout out to you. I'm a nursing student right now. Any tips on dosage calculation? Know about your conversions, understanding what they're asking you in that question, as well as knowing what is that dimensional analysis. Like you really, really got to pay attention to that. Hey, shout out to you. Shout out to you, Cass. That's what I'm talking about. So, what's up, Tim? Hey, I appreciate you, man. I appreciate you, brother. All right, bro. Thanks for the knowledge. Take care, fam. Hey, all right, Alex. I appreciate you stopping by, brother. I appreciate all the info. Time for dinner. Good night. Hey, I appreciate you, Jimmy. Thanks for stopping by, bro. Who is that? I know that's right. Well, how did I know it? How did I know what that's what that meant? Becoming her. I know that's right. See what I'm saying? You are so positive. I love it. Look. We all have our own shit going on all the time, right? And if you can't, like, I used to be one of those people that I would go into test every single time and I'm like, fuck it. If I fail, I fail, right? And then what would happen? I failed my fucking test, right? But then I'm just like, why did I fail the test? Well, number one, your mindset you have to change your mindset on how you think about things. Going into a test will be just like going into a business meeting and you want to try to close a deal and make some money from somebody. Or, trying to have an important conversation with a significant other or your family, or if you're trying to get more money at a job with a negotiate, stuff like that, so you have to be able to put those things out. And if you don't, then it's just going to eat you up inside. Right. So you have to maintain some type of positivity. Just like when somebody says something about, man, I'm not motivated. I was like, it ain't about motivation. You got to be disciplined. You have to have the discipline in order for you to succeed in somewhere. Because I can tell you right now, a lot of times I ain't gonna lie to you. A lot of times I'm not motivated. I'm not motivated to come up here. A lot of times I'm not motivated to get over here and get behind this light, get behind this camera, turn this beautiful sign on. Can y'all see that? Can y'all see that? Look at that. Turn this sign on, right? And start recording videos because I work a full-time job. I'm a father. I have a significant other. We have a house. We have all these things going on. Right. So it's like I get unmotivated all the time, but I'm still disciplined enough to get out here and put this work in. Right. Because the one thing I say, and I don't know if you guys heard it what I said earlier, but we don't quit around here at all. We don't quit around here. So I'm all about pushing that positivity. I'm all about those words of affirmation. I'm all about putting things out into the universe. I'm all about it. I always discourage people doing the LPN program. If they plan to further his or her education, maybe if that's what they decide that they want to do. If they want to do LPN, who am I to stop you? Because I don't know financially like what you have going on. If you want to go LPN, cool. But if you do have the aspirations to want to go somewhere else, go and do that too. Yo, who just gave me like 1,000,000 roses? That's what. All right, I am Andrea LVN Mansfield. Oh, okay. Shout out to you. Can I call you Drea? Oh, that's what your name is, Drea. All right, shout out to you. I've been a nurse assistant for 12 years. I'm going to nursing school to be an aesthetic nurse. Hey, shout out to you. You already know what you want to do. And now put it out into existence. As a matter of fact, go get you a sticky note or go get you a piece of paper. Write, I will be a nurse or I will be an aesthetic nurse and post that like somewhere where you know that you're going to walk past it all the time. And then answer yourself. You want to own my own med spa? No, that's what I'm talking about. New here also. Hey, look, if you're new here, all 21 of y'all, I need for everybody to follow me right now. And if you ain't following me, what are you doing with your life? And if you ain't following me, hey, y'all see Nurse Cass? I just want to let y'all know. She's like the head of my security. And if you don't follow me, she will come and put you in a chokehold. And she'll be like, hey, follow this man because he's spitting game. Listen. All right, stop playing with me. Like me. Love me. Give me all them likes. I want 10,000. Make it happen. Love you. Appreciate it. Anyways, but yeah, that's what we're about. Words of affirmation, putting out into the universe, speaking it into existence. Love it. Make it happen. Just because the core is almost the same. You are correct. You are working. You are less likely to go back both 2 years. Once again, like I said, financially, it all just depends. Zara said, I passed these exams by having an shit amount of delusional confidence. I mean, you don't got to be delusional about it. You ain't got to be delusional. So, What she say? You discourage people to go unless they further their education. Why? Okay, absurd. Oh, Fatima, you gave me six. Oh, I don't know if Fatima's still here. I appreciate the roses. You gave me 16. That's the most roses I've ever got up in here, yo. I appreciate it. Hey, look, hey, as a matter of fact, that's kind of like, like extortion. Like, you just gave me money so I didn't have to send cash after you. That was a real smart move. I'm just saying. No, I'm just playing. I appreciate the love. I appreciate the roses. I don't ever get roses. So, like, when I see them, I really don't even know what to say because, like, that's just really nice. So, thank you. Because the RN is 2 years, so the LPN is GA. Okay. How do we get started? How do we get started with what? What are we talking about? What you mean? Is it VPED? CAS, all well, and it's 12 to 14 months. It all just depends. Like some LVN programs usually LVN programs are a little over a year. But like I said, it could be like going the LVN route could be cheaper. And some people want to get into the nursing field faster. So it all just depends. Like I said. Better option for me at the time. Exactly. That's what I'm saying. Each state is different. Definitely bridge when you can, for sure. Exactly. And see, now that's where I'm talking about where we all have a difference of opinion, but we don't, but don't nobody need to act crazy. You know what I mean? It's just like some things work better for others. You know what I'm saying? But shout out to all 21 of y'all up in here. Like, hey, we've been, I don't know how long we've been in here, like almost an hour. So we've going strong. Y'all missed it. Like the first half hour I was up in here, but I had something that I had planned and I kind of fell through. Didn't really work out. So I decided to jump back up on here and we give some knowledge. But shout out to all of y'all that are on here. If you guys are brand new here, number one, if you're not following me, what are you doing with your life? Number two, if you haven't gotten me to 10,000 likes, what are you really doing with your life? Number three, my name is Kevin. How are y'all? Welcome to the live stream. I go by the Boot Nurse on all social media platforms. So make sure you guys go over there and follow me. If you know anybody that needs this type of, interaction, make sure you guys share it to them. All right. And if they miss it, they can go over to my YouTube channel. So every live stream that I do, I put up on YouTube. Mostly it's because, I do a lot of repeating myself, but hey, like if you miss it, you get that content over there. So that way, you never feel like you miss out on anything. So like if you work late or anything like that. So I also have a Facebook page called the Boot Nation Facebook page. It's for pre-nursing students, nursing students, and for nurses alike of all ages, shapes, and sizes. We are trying to foster a great nursing communication community here because gone are the days, at least around me, where the nurses eat their young. I don't play that. Like, I don't give a fuck how long you've been a nurse, but you ain't going to talk to me or nobody else around me like you lost your mind. Like, the whole point of being a nurse, especially a senior nurse, is to groom and bring up the younger nurses because someday they're going to replace you. Not every nurse is going to be like these other nurses that if you've read in articles just recently that did 60 years at bedside. Why you did 60 years at bedside? Man, when I tell you that's a calling, that's a calling. Because I can tell you right now, for me, bedside is ghetto. However, I've learned a lot off of bedside, and I've made some really good friends off of bedside. Some friendships that I'll never take for granted because those people are absolutely wonderful. But I met some really terrible nurses that if they got flat tires on the side of the road, I would leave them in that's 107-degree heat. I don't mean that. I don't mean that. But anyways, so yeah, make sure you guys check me out on all those social media platforms. Also, if you're a brand new nurse about to start nursing school and you want to get a jump start on your NCLEX, make sure you guys check out the 7-day NCLEX course for $48. The link is in my description. For $48, you get it and you have it forever. It's in this pre-launch phase, so I'm consistently updating content. But once you get it all the time and you have it for a lifetime. It's 80% off the current price right now, so make sure you guys go and check that out. And if you want to gift it to somebody, send it to them and be like, hey, I'm going to get this for you as a gift. So by the time you start school and then you finish school, which is a year or 2 years, 3 years, however long your program is, it'll be there for you. All right. So if you're new here, first of all, you better be following me. Two is I want to know who you are, where you're from, where you're at in your nursing journey. You taking your NCLEX? You taking it multiple times? Have you failed it? Are you into pre-nursing? Are you a nursing student in nursing school? Are you a nurse that's been a nurse for like almost 20 years and you punch people in the face when they, act out of pocket? Like, do you do that? Don't tell nobody you do that because that might be a no-no. So, yeah, let us know who you are. And of course, we've got all these experienced nurses that are in here that have no problem giving their expertise and different ways that you can navigate through the nursing profession. All right. I missed the first half. Don't worry about the first. If you missed the first half, I'm actually going to put them. I'm going to put the first half on YouTube, and I'm going to put this half right here on YouTube as well. I actually didn't even put the one from Friday up there, so I'm going to put them all up there. I haven't been to school in 6 years, but don't know how to get started for an RN. Well, the first thing is you got to think to yourself, like, is being a nurse what you want to do? That's number one. Number two is you got to look at whatever school you want to go to. Then you got to see if they're accredited, because we don't have any hashtag fake nurses in here. You see what I'm saying? I know Sasha's not in here. She usually comes after me like, stop telling people that in Florida. I just assume that that's what she sounds like. Don't tell her. Don't tell her I made fun of her and she sounds like that, because she probably don't. But anyways, like I was saying, make sure that they're accredited. Then you look at their prerequisites. And then once you decide the school that you wanted to go to, then you start taking the prerequisites at a community college. If that's what you want to do, it's also the cheaper route. Once you get finished with your prereqs, then you apply for your schools. Or when you're getting close to finishing your prereqs, you apply for those schools. Okay. Let's say Naya. It says, hey, just joining from Texas. Shout out to you, Naya. I am also in Texas. What part of Texas are you from? Cass says, currently in the middle of renovations with my bathroom, so I'm drinking. Of course you are. Respectfully, of course. Make sure you don't drive and you drink responsibly, because that's what we're all about, being responsible here. I'm in school now. I finish in December. Shout out to you, Gifted, because we all know that getting through nursing school is a journey, and you are almost at the end of the nursing school and nursing graduate journey before you become a nurse. So you're almost to the finish line. This is the hardest part, is getting to the finish line and pushing through. And getting through the finish line of this stage of the journey is getting that license. All right. So don't stop. Who is that? Fatima. I stand with God. Taking my NCLEX. Shout out to you. Felicia says, I'm from Orlando. Took first time, failed, about to take again. I know that's right, because I'm trying to tell you, if you fail it, that's okay. If you're unsuccessful, that's okay. But then I'm always going to ask you, now what? What are you going to do? Like, what are you going to do? Okay. Like, look at those breakdowns, figure out why you didn't do well and improve upon it. I'm just a Grey's Anatomy observing nurse. No, you did not just come up in here and just do anything Grey's Anatomy. How dare you? Houston, Texas. Shout out to H-Town. I live in San Antonio, so 3 hours like west of you. I've been to H-Town. It's cool. There's certain spots in H-Town I don't go to. Anything that has a ward at the end, I go to places that are bougie, because that's just me. I don't do what we like to call deployment tourism. No need for me to go to any wards. I'm just saying. So definitely not. But on a positive side, I have many lawyers and judges' personal phone numbers. That is great to know. I may need them in the future. User 55. Why are you going to cry? What are you going to cry for? What's up? How is the updated NCLEX? Who says that? Is it Sarame? Is that how you say your name? Sarame? The updated NCLEX is honestly the only thing relatively that's changed with the NCLEX is the format, meaning how the questions are delivered. The old questions are still there. Select all that apply, the drop boxes, or the place things in order. What is it? Your multiple choice questions, your dosage calculations, like those are all still there. What's changed is the format. So they added the case studies where they give you, each case study has up to 6 questions. They have up to 6 questions. They have the extended multiple responses. They also have partial credit. There's all kinds of stuff that they added. Bro, yes, I'm back. I'm sorry. Hey, so I just want to let all 15 of y'all, I just want to let y'all know. So Nurse Nelly is one of my co-hosts, and I didn't let her know that I came back on here, and now she's here. So shout out to her. Everybody say hi to her. She's been a nurse for 4 years. She also has worked in the ICU. She's worked in med surg, and now she's a case manager. So now she does all that. She's my co-host. And Any question I can't answer. Yes, any question I can't answer, she can answer. Of course, the top flight security down there, Cass, she can do it. She can answer questions too. Yeah, if I was your co-host, you should let me know. You're right. You're right. Don't be salty at me, okay? It was actually a last spur of the moment thing. Whatever plans I had for 5:30 definitely got canceled right as I walked out the door. So, how you got so many likes? Look, I don't even know. Look, hey, I didn't even look. Check this out. I got likes and I got roses. I got like 16 roses. Like, why? Like, I don't even know why. I don't even deserve them roses. But I do deserve 10,000 likes. So I'm going to need for all y'all to make it happen right now. If you don't make it happen, you know what's going to happen. I'm just saying, make it happen. Make it happen right now. Because you know when I play this song, she's coming for you. All right? Hey, Nelly, I just want to let you know. So now we've added a theme song for anytime Cass comes up in here. I literally have to have this on standby. Like, no lie. I got to have it on standby because they think I'm playing. They think I'm a joke, and I'm not playing. All right. So I saw a bunch of people ask a couple questions in here, but they kind of got lost. So let me see what's going on. A friend of mine said he got all fundamental questions, and other ones said they got all mental health. So it says, can you recommend any review classes? So the one thing I'll tell you, I'll answer your question here in a second, but the one thing I'll tell you is that the NCLEX is a computer adaptive test. The test will give you questions based off of how you answer the previous questions. So some people get a lot of cardiac, some people get a lot of respiratory, some people get a lot of peds, some people get a lot of mental health. It all just depends. So even though you get a lot of mental health, it still hits those 8 sections of the NCLEX pie, those different categories: management of care, pharmacology, physiological adaptations, reduction in risks, infection, basic care and comfort, so on and so forth. Can you recommend any review classes? They have a lot of reviews that are out there. Number one, I'll say is, of course, go check out the 7-day NCLEX course. But that's in its pre-launch phase. If that's not for you, then that's not for you. And I'm one to definitely admit that if it's not for you because I'm consistently building this course right now, then I'll recommend, hey, don't look at that. But then you got Kaplan, you got Mark Klimic, you got Remar, you got you got Picmonic, you got UWorld, you have Archer. You have like registered nurse RN. You got simple nursing. You have all these, NCLEX high yield. There's a whole bunch of other reviews that are out there. Any of them I recommend. However, in the end, it is all based off of you and how you retain information, understand the content, and able to apply that content to NCLEX style questions. What does it say? Others got combinations of questions. Yep. Play a lot, but seriously, I got y'all. Just ask. I got you. I appreciate it because I'm not here. Yeah, I got another rose. Oh, hey, Fatima, y'all are something like that. Hey, look, Cass, I told you I got you. I got you out here. I just got done cooking. Hey, what you making out there? Like, Nelly, what you out there? What you out there cooking? What you out there cooking? Let us know. Let us know what you out there cooking. All right. Practice, practice, practice. The test will be your best friend. 100%. You definitely have to be able to apply what you've learned into the questions. That way you're familiar with what the questions are going to look like, at least, the format, how they're going to ask them, how to break down the questions. What are keywords that are in the question that you want to look out for, right? Because there could be a single word in that whole question that could change all the answers. You see what I'm saying? So those are something that you definitely want to pay attention to. Y'all already know what's up. Y'all already know what's up. So, but yeah. So what does it say? I got a lot of cancer questions. I was totally not expecting that. Was prepared for peds and maternity. This is why when you study, you have to get a good understanding. Remember, this exam is not about memorizing. It's not about memorizing. It's about keeping yourself familiar. And another thing I'll say is they have certain ones. So who said this? Sarame said something about UWorld. So here's one thing I'll say about UWorld. The only thing that UWorld provides are questions and rationales. Now, if you're a person that has a good understanding of content, then a question bank may be just okay for you. But then you could also go to Archer and get content videos along with NCLEX style questions and apply those. And then like, so if you're not understanding something, you're like, man, like I really should go and review that. You know, Archer may have a video for it, but UWorld does not. You see what I'm saying? So it all just depends on what you need. When people come to me and they're just like, hey, what review should I get? I'm going to let you know I don't know, because I don't know what you need, which is another reason I created my course, is because if you purchase it, maybe you just need questions. Maybe you just need content. Maybe you need both. You see what I'm saying? So why not make it all encompassing? But it all just depends on you and what you feel that you need. I try to tell everybody to get content and get the questions, because if you have both, the chances of you doing better on your practice exams are a lot higher. Regular smoke salt. Okay. Okay. Let's see what we got. What am I? Oh hell! Why is it that right when the food comes, here comes Sasha? Hey, just for that, Sasha, since you decided you want to come up in here late, get me to 10,000 likes. Make it happen. If you don't make it happen, Sasha, I'm sending Cass after you. Listen, Cass got a theme song. She got a theme song now. So anytime you hear it, hey, anytime you hear it, just know she's coming after somebody. All right, don't play with me. All right, make it happen. I love y'all. Hey, Sasha, how you doing? Thanks for joining. Oh my God, there's no way of knowing what the test will give you. Yep, that's true, because everything is computer adaptive. Y'all lucky I'm at work. What you mean? You be talking when you're at work anyway. So, how's our wife doing? She good. She made look. She made was it like a con queso something, and I haven't even tried it yet. I specifically was waiting for you to get here so I could eat it in front of you. Sasha, I was playing. How can I purchase your review? Is that Renante? The link is in my bio. You can check that out. Just know, I'm letting you know right now that it is in the pre-launch phase. So it is not complete, and I'm consistently updating it. And if you feel like that's for you, please, by all means, check it out, okay? Nurse 74, all the questions on the test are pertaining to you, the nurse. Ask yourself, what would I do? Yep. And it's all about safety, nurse safety, right? How can you perform as a safe nurse, right? Archer was great. The CAT exams and readiness really helped. Shout out to you. Like me, I liked Kaplan. I used Kaplan. And I thought Kaplan was great. Kaplan and Mark Klimek were actually the two reviews that I use, and that really encouraged me to, make my own. And I'll keep it all the way honest. Like those are the two reviews that really, really helped me. And plus, like I was already teaching, so the way that they taught and a lot of things were relevant. So I was able to, apply that to other people. Fatima said, I need help. Hey, if you need help, check out my website. What's it? Oh, Cassie going to be my friend as well. Oh, okay. Advice on PA school. Ma'am, D, this is not a PA. This is not a physician's assistant type of conversation. However, since you asked, I'm going to answer it for you. Just like any school, you want to know what the prerequisites are, right? So you need to know what schools are, what their prerequisites are. Two of my buddies actually just graduated from PA school, not last Friday, but the Friday before. So like a week ago or 2 weeks ago. Just letting you know that it was really hard for them to get into school because PA school is very, very competitive. Okay. So you want to make sure that you are, you're stunting on all those classes, especially those required science classes that they want for PA school. Okay. Help on answering questions. I'm good with content. Okay. Fatima, I do coaching. I do NCLEX coaching, and I'm working on the last live stream I did NCLEX style questions. I went through like 2, but everybody's like, I need to see them. So I'm working on getting it on the computer so everybody can see them, because, most people are visual as they should be, because that's how your questions are going to be. So, but if you need help, you can check out my website and then look at the mentoring and the coaching. And if that's for you, check that out. But, we'll go over some questions as well on here too. Mark Klimek saved me. He did for me as well. And it's crazy is because before I even found out about him, that's the exact way that I teach. It's very relevant. You want to put it in very much layman's terms for people. Thanks for Din. Love him so much. Straight up. You're welcome. Somebody got filtered. They out here saying some nonsense. Hey, but I'm about to try this though. We about to see what's good. Yo, that was good. They got like rice in it. They got all kinds of like deliciousness in it. Like I ain't even watching. It's so good. It's so good right now. I ain't even lying to you right now. It's so good. I got you to 10 likes. Yes, I am. I appreciate you. And just for that, since you got me to 10 likes, 10,000 likes, and you can't take them back, this is what you get for coming in late. You see this, right? You see it? Look. Oh my God. Oh my God. Sasha is so good. Sasha is so good. It's so good. Oh my God. All right, I'm done. I shouldn't have did that. But it's so good, Sasha. Hey, look. She even gave me chips. Like, really? It's so good. Anyways, how y'all doing? I got 14 people up in here that's sitting here just listening to me talk. So I appreciate y'all. I need all 14 of y'all to share this to somebody. And then I need all 14 of y'all to like me in some way, shape, or form. And then I also need you for y'all to follow me. Like, what are you really doing with your life? What have I done? Hey, what have I told y'all? I told y'all that if y'all don't do it, I'm sending her after y'all. Y'all hear? If a nigga come and run their matches like a hoe. I'm trying to tell you. I'm going to send her after you. So make it happen. I appreciate y'all. If y'all are just now jumping onto the live stream, my name is Kevin. I go by The Boot Nurse on all social media platforms. Make sure you guys check them out. But I want to know about you. I want to know who you are, where you're from, where you're at in your nursing journey. Pre-nursing student, nursing student, taking NCLEX. You a nurse, already been here hanging out. We want to know about y'all. My co-hosts, many of them, got Nurse Nelly down there, been a nurse for a while. She's one of my co-hosts. Then, of course, we got Sasha, who decided she wanted to show up late. She's also another co-host, and she want to come up in here and answer questions and stuff. And you got Nurse Cass, who is the top flight security of the live stream, hooking it up. Been a nurse for quite some time. She works in corrections and has worked psych, and she will fight you. I've literally seen her do it. I've never seen her do it. So, hey, any questions that you guys have, and ask them down in the chat. And if I can't get to them, they'll get to them before me, and then they'll answer your question. All right. Notice you lose. I do notice that. Like, notice you lose viewers when you're talking to me and Sasha. Yeah, I did notice that. That's kind of mean. Hey, y'all need to bring it back. Bring it back right now. Y'all need to stop playing games. All right. But anyways, I noticed that it's just like the best time for me to stream, honestly, is between like 5 and 6:30. Like when I first streamed, I think when I streamed earlier, I think I had like 85 people in here, and they were in here for like a smooth 15 minutes. I'm like, oh, I got 85 people that like looking at me. Look, I appreciate y'all for wanting to look at me. But I'm gonna tell you one thing. You ain't gonna see me up in here doing ASMR, and you ain't gonna see me up in here being like AI. Even though like whoever's doing this AI nonsense, like yo, that shit is crazy. These people are making some money off that. That's crazy. So, facts like I met these two through here, and we just clicked. Like it's cool. Yep, that's what I'm trying to say. We appreciate you. Sasha, you know I appreciate you being here. How do you feel about travel nursing? Do you know pros and cons? I would recommend any nurse, once they get at least a year of experience, to go travel. The pros, more money, like lots more money. The cons, you may not get a contract. The cons is when you do get a contract and you're at a hospital, 9 times out of 10, these people, the people at a hospital, since you're making more money than them, they want to give you shitty assignments. Like the travel nurses that I had when I was in the ICU, they used to give them the train wrecks. I mean, the train wrecks of patients, setting them up for failure. It was so terrible. What else? Another pro is like you could do a 13-week contract and then take, however long off before you decide you want to start another one. I know one girl who does travel nursing, and she doesn't work on any major holidays. Like she'll work, her kids will go to school in January, and she'll work all the way to March. They'll go on spring break, and she'll have off. They'll go back to school, and then she'll work all the way until the summertime. Then during the summer, she doesn't work at all. And then when they go back to school, like in August, September, that's when she goes back to work. And she'll work all the way from when they start school all the way to Thanksgiving, like the day before Thanksgiving. And then she won't go back to work until after the kids go back to school in January or after the New Year. So That's another pro is like you can literally work that schedule, and work it in your favor. There's a lot of pros, there's a lot of cons. Those are the ones that are just jumping out to me right now. So, 2 years, please, because baby, it's not easy out here. You right? Why why is it that as soon as you said baby, I knew exactly how you were gonna say? Oh, because you're right, it ain't easy out here. Because you already know how they treat travel nurses. It's not good all the time. So I work with some and they look miserable. It makes me wonder if it's worth all the stress. It depends, like you look at them like they're miserable, but we don't understand like their dynamic of what other things they have going on. We don't know how long they've been traveling, like we don't know what other situations they've been put in, just like the situations that we've been put in. We don't know exactly what they have going on. And you got to think, it's just like, I've literally seen it where I've seen other nurses be really mean to the travel nurses and they were there for like a week or two and then they left because they were just like, oh, like they were like the staff nurses fostered a terrible work environment for the travelers. And I'm like, yo, she's here to help us. Like, why are y'all being assholes? They were like, nah, fuck her. She lazy. And I'm like who, like, it really blew my mind for the fact that something like that could be determined. Like it was so stupid to me. I'm just like, I can't even believe y'all. It's so stupid. Oh my God. Sasha, oh my God. Yeah. It's so good. It's so good out here. I don't work weekends or holidays either. That's right, you don't. Because Nurse Nelly does case management. And she works Monday through Friday as much or as little as she wants. Don't do holidays, don't do weekends. So, exactly, I don't want the drama, but the money looks beautiful. So let me tell you something about money. Not all money is good money. And I'm telling you, no amount of money is worth the mental health that you will experience due to nonsense. I'm trying to say, like, hey, look, during COVID, there was a lot of, these nurses out there making like $10,000, $10,000 a week. Some of those nurses already hardened for it, but then, I mean, like nobody really expected all the craziness that was going to come out of that. And some of those nurses, a lot of the nurses have a lot of just mental shit that are going on with them now. So sometimes that money, look, just because when they offer you money like that, you better be looking to see like what the hell's going on and what you about to get yourself into. Sasha, you ain't gonna fight me. Stop it with the malarkey, with the shenanigans. They treated our travelers like they were stupid, but they were some of the smartest people I know. Let me tell you something. When I had that train wreck come through and I talked to one of the travelers, I was like, can you please help me? And then she was just like, I got you, baby. Give me 1 second. And she came over there and I'm telling you right now, that woman saved my life. Like she saved my life because of the deficit that I had in my, the knowledge gap that I had when I was working in the ICU, which is fine. Because we all have them. Like she had been working in the ICU like 10, 12 years. And like nothing phased her. You see what I'm saying? So, and they gave her 3 vented patients. And I had 2. I had 2 at first, at that one day. Then I had a walkie-talkie. And then they sent me up a patient that was septic from the OR. So I had 4 patients. 3 of them were on vents and then 1 was a walkie-talkie. Now that was one of the worst, if not the worst night I had in the ICU. It was terrible. The travel nurses were fucking amazing. What do nurses get if they get a Daisy Award? If they get a Daisy Award nominated the nurse from my ER visit for my knee. They don't do shit. You don't get nothing for a Daisy Award. You get nothing. The only thing they do for the Daisy Award is that they bring you that piece of paper. The CEO or whoever the hospital is or the CNO is gonna come, shake your damn hand, tell you, atta boy or atta girl, great job for whatever you did, and don't knock. And I'm not knocking that because they very well may have done a fantastic job of taking care of you, which is what we do, and we take pride and, we take those things home and like, man, like I really do feel good about that. But that Daisy Award is just a piece of paper. And then they give you a nice little pen saying that I got the Daisy Award. And that's it. It does financially nothing for you. Recognition, great. On a resume, no one cares. You know what I mean? Aubrey. Hi, Aubrey. I work drop. Yep. I worked, dropped 8. Look, you work from 8 to 11:30 today. Must be nice. Must be nice. I can't really say anything because that'll be me soon. So I rented a room to a travel nurse when I lived in Wisconsin. Best cook I ever met. Hey, straight up, straight up. And there's a lot of people that do real estate, like, or they do like commercial real estate or Airbnb or whatever, and they rent to travel nurses because one, they know that they're going to get paid, and two, I mean, who doesn't want to help out a nurse? You know, and especially if you know they're working nights or anything like that, and you know the family environment, the kind of the quiet family environment, like that's a lot what the nurses want. That's what they need. You know, so by you renting a room out to a travel nurse, like people don't realize how great of a thing that is when they rent out something, when they rent out, you know, rooms like that to travel nurses, because after all that chaos that they go through in work, they need a sense of peace. You know, so you get a pen. Yep. Damn. No kind of money or anything. Nothing. I look, for the Daisy Award. I've never seen anybody get any money. At least I'm not at my hospital. You get recognition. You get your picture put on, whatever, and that's it. Nelly, they like at your hospital. They gave extra money. I'm curious to know about that one now. Let us know. I didn't know that. I know for a fact at my hospital, they don't give it. But then again, you know, I'm a little bit older, so I don't really care. That's what I heard. Clearly, I wouldn't know. I never got one. Same. Never got one. Our hospital doesn't, just a picture and an email, right? That's all they give you. Picture and an email. Hey, let's give a huge shout out to Nurse blah, 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 blah for the Daisy Award. Woo! All right. All right, now get your ass back to work. No. Back over to that patient. Mm-hmm. Yep, make it happen. That's exactly what it is. So, Queen Tanya. Hi, I'm a pre-nursing student and taking anatomy for the second time this fall. Any tips? Honestly, with anatomy, it's all just really memorization. You know, like you don't really have to, not saying that you don't have to be familiar, but it's all about memorization. And I mean, I know a lot of anatomy classes are broken up differently. Like when I took anatomy, I did anatomy and physiology with a lab. It was 1 and 2. Anatomy 1 was the first half of the book. Anatomy 2 was the second half of the book. There was a girl I was in class with who ironically and weirdly went to A&P 2 and then went to A&P 1, which was weird. I mean, it doesn't really necessarily matter, but that's what I would say. That's what I would say. It's all about memorization. So just get familiar of having your face in that book. And then figure out why you failed. Like, what is it that you didn't get when you were taking that exam? Some PTO would be nice at least. Let me tell you something. I get sent home early, and they automatically they automatically deduct your PTO if they send you home early. I'm just like, oh, I didn't know that was a thing because I was putting in for something. They were like, oh, you don't have any PTO. I'm like, what the fuck? So, yeah, you don't get no PTO. Hello, 2-year LPN here. What are your thoughts? Should I do or should I go for LPN RN, then get my BSN online? As I say, Inlaid Bacca. Well, nice name. No. First thing I would say to you is, what is your financial background or financial, capability? Like you're already an LPN. So here's the thing: if you bridge, like you've already said, if you bridge from LPN to RN, you're going to get your associate's degree. You're going to you'll take your NCLEX and you'll be a registered nurse. Get your BSN online. You'll still be working. You know what I mean? The BSN takes the same NCLEX as the associate's degree RN does. You know what I'm saying? So, financially for you, if it makes sense, do it that way. Now, if Cass was in here, she would be like, go straight to BSN. However, and she lives in Georgia, and she has a different thought process on how things work, which is fine. But I always say, based off of what can you take care of financially? Me, I'm not about going in debt. However, if I know if the benefits outweigh the cost, I'll go in debt. because I know that if I came out here and if I decided I wanted to work as a nurse and then I wanted to go be a travel nurse for like a year or two just to pay those loans off, I'll do that. That's what a lot of people did during COVID. That's what a lot of people do now. So if it's financially feasible for you, then you can go all the way. However, if it makes sense for you to get an associate's degree in it, right? Listen to what I'm telling you. Get an associate's degree in it. Take you 2 years, maybe a little bit less, depending on whatever you have. Get into that RN, the ADN RN program. Get that degree. Get that RN. The NCLEX is the hardest part, in my opinion. I'm sorry, I take that back. Nursing school is the hardest part, but the NCLEX, the RN, the license is the icing on the cake, and you need to have that icing on the cake, right? So, but then when you go to do your BSN, you could essentially do that you could self-pace that. You know what I mean? But you'll already be working as an RN. So by the time you get your bachelor's degree, you would have already had a year or 2 years experience working as an RN. If that makes sense. So, plus I already have all my prerequisites complete. I would say if I could have done it all over again, I would have went to an associate's degree RN program because I would have gotten my license. Yeah, I would have gotten my license. I would have been working, and I would have been doing my BSN online, which would have been self-paced. You know what I mean? Which would have made a lot more sense because then by the time I would have got my bachelor's degree, I would have already had 2+ years working as a nurse. And I was actually trying to get into become a commissioned officer in the military. So, and you needed to have your bachelor's degree. So that would have already looked really great for me to direct commission because I would have already had my bachelor's degree and I would have had 2 years of experience working. So is it easy to start off in the ER/ICU as a new grad? If so, do you recommend it? All right. So I'm going to get a lot of flack from this from my co-hosts, and that's okay. And they already know what I'm going to say. But go to where your passion lies. So if you want to go ER, go straight there. If you want to go ICU, go straight there. My constituents will always say they believe that everybody should go to med surg first so you can get your time management, your critical thinking, and all the other stuff down. Now, if you start there, there's nothing wrong. I started in the ICU. I worked in the ICU total a year, and then I left the ICU because there was an unsafe patient. There was unsafe patient to nurse ratios. There was unsafe practices that were going on, unethical things that I didn't like that was going on, and there was no support. You know what I'm saying? So I say go where you want to go. You don't have to go to med-surg. But if you want to go to med-surg, that's okay. You know what I'm saying? A lot of people say go to med-surg, but then some people are like, I want to go to labor and delivery. Go to labor and delivery then. So go to where you want. Go if you want to go critical care, go there. If you want to go trauma, go there. Gone are the days where people are saying, oh, you need to go to med-surg. Those days are over. Go to where your heart lies. That's what I would tell you. Fatima, welcome back. Exactly, Sasha. You don't have to go to work in med-surg. You don't. I've been a nurse for 3 years and I haven't worked in med-surg. Not once. Oh, how was my experience with my first code? Well, look, you might want to take a seat for this one. Have you experienced nursing in the DMV area? I'm thinking of relocating after my RN. DMV? What's DMV? Where's the DMV? I thought that was Dallas or that Detroit. I don't know. When you're talking about DMV, I'm thinking about the Department of Motor Vehicles, and I'm just like, I don't know how their nursing is. Oh, okay, DC, Maryland. I got you. I personally have never been to the DC area. I take that back. I have been to the DC area, but I've never experienced any nursing there. So I really can't speak upon that. I'm pretty sure somebody else can, but I personally have never been there. Let me see. How was your first experience with your how was your experience with your first code? Well, user 39. As a nurse, I was already prepared. I had already done codes before. So my first code was, as a nurse was no different from when I was a corpsman or no different when I was a surge tech. I went straight to where I was comfortable first, which were chest compressions. And that's what I did. I was part of the chest compression champ, I guess. And then from there I moved over to meds, pushing meds the whole time. Like there was something in, I eventually, I pretty much did chest compression and I did meds. Other people did the crash cart. Other people did the AED. Other people were scribes. I never led a code. I just didn't want to. Other people jumped to the opportunity and did it before I did. So, but my first experience was, as a nurse, it had been a while since I did a code. So it was a little rusty, but I knew exactly, like my body just kind of threw me into going to the chest compressions. So once you do a code after a while, your body will just kind of just lead you in that direction of like where you want to go or where you need to go. You always go to where you're comfortable. Like, because if you've never done it, you can slow the whole process down. Need all the positive thoughts. Take my HESI tomorrow. If all goes well, we'll sending my app to the LVN school. Shout out to you. So you say you take your LVN, or you say you take your HESI tomorrow, and if all goes well. And there is no if all goes well. It will go well. Speak it into existence, right? Speak it into existence. Put it out into the universe, and it shall be so. All right, kind of like Yoda says, do or do not. There is no try. Yeah, that's how we make that happen. Fatima says, currently in the ICU as a unit secretary, ultimately want to work ICU. Does that put me at an advantage? So you're the unit secretary working in the ICU, Fatima. But my question is, being in the atmosphere of the ICU can help because you see what they go through. But you will be at a little bit at a disadvantage because you don't do the actual job, if that makes sense. You know what I mean? So if you have jumped into those things and done codes and, if the nurses there are teaching you, you definitely do have an advantage when it comes to, those type of things. Ever worked as rapid, like part of a rapid response team? Every nurse in the ICU is part of the rapid response team. Every ICU nurse is part of the rapid response team. And I have responded to many of rapids. I have responded to many of code blues when I worked in the ICU. So to answer your question, Fatima, yes, I have. So shout out to all 16 of y'all in here. Make sure you guys share this live. Let everybody know that we're out here. We're out here talking nursing, talking NCLEX, talking essentially anything that you guys want to talk about in regards to the nursing field. Got a lot of people that are in here that are, believe it or not, in the same position that you are in or that you will be at some point in time. Okay. So make sure you guys ask those questions. The nurses pull me in for some cool procedures and I ask a million questions. Okay. So by you being exposed to those, then, you can already learn a lot when it comes to being in the ICU. Now, observing and getting to experience it is a lot different than, being fully in charge of it and being left alone to monitor it. You know what I mean? So, not saying, obviously, because you're there as a unit secretary, because obviously, like, you could get stuck in a room and just ask all the questions and look and be like, man, I want to do this. But then, of course, you have to go back to whatever your regular job is. You could also, what you could also do if you really want to, if you decide to, because I can't remember if you said you were in nursing school or not, is go to the Red Cross in the hospital and tell them like, hey, I want to volunteer as a volunteer in the hospital. Because when you apply for nursing school, that's one of those things that you can put in there as in like your volunteer hours, part of the Red Cross, saying like, hey, I volunteered my free time working in the hospital, helping out nurses. Nurses in nursing school, the instructors and stuff, they like to see stuff like that. You're already in nursing school, so you're good. You're good. So I hope that answered your question. Be right back. Hey, go handle it. You didn't even have to tell me that, Sasha. Go handle it. She did the same thing in the last stream. She's like, be right back, y'all. I got a code. I'm like, why you tell us that you had a code? You should have came back and be like, hey, I was at a code. So, but think I'm gonna hang out here for another 15 minutes. I usually say that I'm not gonna stream that long, but I end up streaming long because you guys end up holding me hostage. There's only 7 people in here, so I appreciate all 7 of y'all that are still rocking with me. I really do. We got 11,000. We got 11,000 likes, y'all. I appreciate all that. Give me the 12. We're at 11.9. Somebody got to give me. Somebody got to give me 100 likes. Somebody got to give me 100 likes. Somebody got to do it. Thank you so much. You're welcome, Fatima. How can we get the most out of clinicals? You can get the most out of clinicals by asking your preceptor or asking your preceptor at your clinical site, saying like, "Hey, I want to do everything." All right, that's how you can get the most out of your clinicals. Because by this point, you should already know your health assessment. You should already know what your focus and your head to toe assessment is. You should already be honing in on your time management, right? If you haven't done grand rounds or been a part of the rounds when the providers come around, make sure you'll be a part of that, right? So at that point, if you want to get the most out of your clinicals, start trying to take some ownership of what is happening with your patient or patients. Okay, because when you become a nurse, it's going to be that point where the doctors are going to come, hey, who's the nurse for room 2213? You're going to be like, me. And they're going to be like, hey, so what's going on? And you need to be able to be like, all right, well, Mr. Jones, he came in for X, Y, and Z, and now he's, his blood pressure is high, but I did give him, hydrochlorothiazide. What does that do? And I rechecked his blood pressure, about 15 minutes after, and his blood pressure is still high. You know what I mean? Like, it's just stuff like that. Like, those, you got to start taking ownership if you want to start to get the best out of your clinicals, because when you get to your floors, or your floor, it'll help you in the long run. I took my NCLEX on the 10th, had to guess on the majority of it, and I was sure I failed, but you passed. Look at that. Look at that. Everybody, hey, look at that. And you passed. You see what I'm saying? Like, you guessed on the majority of them, but you got the majority of them right. No one's saying that you have to get everything right. You're not expected to get them all right. You have to know what everybody else knows, right? Like, if I start asking you like wild questions about, certain antiplatelets that are like C2Y2 PY2, like inhibitors, you're going to be like, what the hell is that? Not everybody's expected to know what that is. But I do need for you to know what Lovenox is, and I need for you to know what the generic name is, and I need for you to know what the pharmacokinetics of that is, and then I need for you to know the safety aspects of that. Like, are they, like, what if, like, now there are bleeding risks? You see what I'm saying? Now there are bleeding risks, so on and so forth. That's what you need to know. And that's what you knew because you passed. Because now guess what? No one's going to ask you if you failed. No one's going to ask you. No one's going to care. They're going to be like, you got a license? Cool. Come work. We got a nursing shortage. Get that ass to work. That's what they're going to say. But shout out to you. Congratulations, you user 5-4 on passing your NCLEX. Welcome to the shit show. False alarm, black slut. Really? What is black slut? I don't know what that means. I got you to 15K. Oh, I got you. You got me 15K coming. Lord of mercy. Hey, look, I ain't going to stop you. I ain't going to stop you. I appreciate the love, though. Like, shout out to y'all. I swear I don't like psych units. Look, I'm trying to tell you, you and Cass just need to team up and just work in psych. You know what I'm saying? That's what y'all need to do. Take ownership. My biggest takeaway. Yes, you have to take ownership. You have to, because why? Everything is your fault. So now how are you going to figure it out? How are you going to figure it out? Right? Did study groups help? Yes, study groups helped me a ton when I was in nursing school. Like when I met fundamentals was a little stretch for me. But then as soon as I got to med surge, I flat out I made an executive decision. I was like, listen, we have to figure out how to do this together. And they're just like, you're right. And it was 3 other women. If y'all go on my TikTok, if y'all go on my Instagram and y'all scroll back to when I graduated of August of 2018, you'll see there's a picture of me with 3 other women. Those 3 women, the 2 Jennifers and Valerie and the 2 Jennifers. Those 3 women all four of us are the reason why we graduated. And I say that wholeheartedly. And we all still talk to each other. Like we're all still friends. You know what I mean? And we all fed off of one another. If we needed to do studying, like they'd be like, hey, we need to break this up. All right, cool. We would break up all the studying and divide it evenly. And then we would set deadlines with one another. And then when we were done, we all exchanged. We had a Google Doc. Right. And so the Google Doc had everything that we were essentially responsible for. And then if we needed to print it out, we had all of it there. And so I did a part. The other three, did a part. And then when it came to studying, and then boom, we were wrecking them tests. Every one of them. Wrecking them. All right. So yes, I 100% like study groups. Study groups can be ineffective if they're not used correctly. Like if you start talking about what you did during the weekend, or how you like Taylor Swift, or for the fact that Beyonce is about to go on tour and it's projected to make $500 million. How the hell does that help you? It doesn't. You know what I mean? So it's just stuff like that. Me and her do need to call. I was kidding. I don't think y'all need to work together because, yeah, y'all will for real be fighting folks. But I love it because they be like, how'd y'all met? Look, we was vibing in somebody's chat and we just met and we became friends. I brought that friendship together, y'all. I brought it together. But Fatima, I hope that answered your question. Shout out to all 10 of y'all that are in here. Thanks for rocking with me. I'm gonna hang out for about another 10 minutes. If you are brand new here, my name is Kevin. I go by the Boot Nurse. All social media platforms. Make sure you guys go over there and follow me. A little bit I want to know about y'all. I want to know who you are, where you're from, where you're at in your nursing journey. Got plenty of people that are down here in this chat that'll answer your questions for you. And of course, if you're a brand new nurse about to start nursing school, check out the 7-day NCLEX course. Currently in this pre-launch phase, $48. You spend more money on nonsense on Amazon. I know I do. Anyways, so $48, you get it for a lifetime. It's in this pre-launch phase, so I'm consistently adding stuff all the time. I have some lectures that I'm going to be adding this week. Up to 8 of them, all in pharmacology. So, the majority of them are in pharmacology. So be looking out for those if you are an individual that is in that program. So make sure you guys check it out. If you need a little bit more help, go to thebootnurse.com and click on the link that says NCLEX Mentoring and Coaching. And if you need a little bit of one-on-one mentoring and coaching, that is also available to you. So make sure you guys check that out. Okay. But yeah, I want to know who you are, where you're from. Let's start vibing over the next 10 minutes. See what's going on. No, we do. I'm trying. Oh, you're welcome, Fatima. I'm trying to tell you. I start working in the jail. I can't. My hospital. Look, you're right. 16 years RN and MBA. What is this? Is that a concierge? Did I say that right? Look, there's a lot of things I'm not good at, and sometimes words are a part of that. Concierge, patient advocate. You're the first person to have a specific title about being a patient advocate, which is something that I really, I guess not take ownership of, but I really, really appreciate, because a lot of the things that happen in these hospitals, in like nursing facilities and stuff like that, I can't do it. Like I can't do it. Like I've seen so many unethical things in my opinion, to where I even asked, I was like, how's this ethical? Like, why hasn't this gone to the ethics board? Like, why? Like, I don't think that we should do this. And then, of course, I write my notes, and then, I get overridden or I do whatever, and then I send it up and nothing happens. So, or nothing had happened. And it was during COVID, so there was a lot of learning that was going on. But like not me going to go look at policies and stuff. So, but yeah, like I appreciate somebody that's a patient advocate, because the last thing you want is for somebody who is, sedated and intubated and they can't speak for themselves. And then people want to make decisions for them that are unethical, just like keeping a patient alive too long, it's just like, why are we doing this? Like when their respiratory rate or their O2 saturation's been in the 50s for, I don't know, like 2 weeks. Make that make sense. You know what I mean? So I've been in those positions before too. And I'm just like, okay, like I don't make those decisions. So, it says, yes, I do private patient advocacy. Shout out to you, board certified patient advocate. Okay. I'm also a regulatory expert. Oh, so you know all about the instructions and all that stuff. I like that. You probably go to court a lot. You go to court a lot. Is that Adrian? Is it Adrian? Did I say it right? Nurse Adrian. Everyone needs to have a plan. 20% of Americans will be solo agers. Yep, they will. Yes, they will. So let's see what else is going on. Oh, okay. I'm at 13 point K. I thought somebody was going to get me to 15,000, but I think we pretty much like run our course. We're about to get off here in a second. What type of nursing is there other than bedside? I was a CNA for 4 years, and it truly burned me out. Well, I'm glad that you asked. So there's so many other things that you can do as a nurse, such as you can go and work at an insurance company as a nurse, doing case management, data utilization, um, uh, uh, and they have clinical analysis and stuff like that. Those are all remote jobs. You can actually go work for medical devices companies, anything from Medline, the company Medline, 3M, Stryker, Intuitive. They have another one called Agility. Think about all the things that you see in your medical supply room. This is for user 54. All the every one of them have a company, right? Go to the company's website and look at the careers and see how they're hiring people all the time. And especially as nurses, those companies, all the companies I just named, they love nurses. Another one, Boston Scientific. That's another one too, right? You can think like you can go work in a clinic. You can go work at a pharmaceutical company. You could be a school nurse. You have to really love children and the passion of to be a school nurse, because the pay for a school nurse is not a good one. What's some other ones? You could do biotech. Like those are a lot of non-traditional nursing jobs that are out there. So there's like when you get your nursing license, you literally become like the CEO of your license. I heard another nurse say that. Her name is Kelsey, and she does whole life nursing. You guys should check her out on Instagram. Tell her I sent you to, because maybe like her and I'll be friends or something. So, but no court. I filed over 200 regulatory complaints against hospitals, nurse managers, and OSHA. Look, everybody need to have a friend like you. I'm just saying. Now as a nurse, I'm already tired. Look, I've been a nurse for 3 years, and I was tired day one of bedside. I'm like, this is ghetto. So you can work for a nurses union. Yeah, that's true. So in Texas, that I know of, and maybe somebody else can possibly correct me on this, but I don't think we have a nurse union like that. There is talks of it happening though. But like in places like in California and in New York and other places, but not in Texas. But after the whole thing that was going on with COVID and the strike that happened at Ascension Seton, that happened in Austin, and all these other things, like I know a union is coming. I know a nurses union is coming, and it should, because a lot of the things that I went through, and that all these other nurses that went through, shouldn't be. It ain't right. It ain't right from an ethical standpoint, in my opinion. So that's why I'm going to nurse education, because I like teaching, and that's just me, and that's what direction I like to go. So there are a ton of federal jobs. Yeah, I forgot what is that? The National Institute of Health and Science. I think it's what the CDC, the VA, et cetera, and OSHA. Yeah. So VA, since the VA, I could speak to this one. That process takes a while. It does take a while. Yeah, the National Institute of Health. That's what I thought. That's the one that's in the big building. It's across the street from Walter Reed. Because I remember I went there the first time, and I was just like, what the hell is this big old this campus that's over here? And they were just like, oh, that's the National Institute of Health. I'm just like, damn, like that's a massively large like campus, like it's huge. And so yeah, I went to Walter Reed a couple of years ago because I was in charge of this program called the Emergency War Surgery course, and we went to USIS over there in Bethesda. So that's how I remember. I was just like, yeah, I know what that building looks like. I've been over there. I didn't go over there because obviously I had no reason to go over there, but I saw it, and that building's big. So Red Cross, yeah, Red Cross hires. Yep, they sure do. I didn't even think about that. Hey, look, that's what I'm talking about. Or here's another one. You could actually be, you could do your own side hustles. Like you could do nurse coaching. You can do health coaching. You can do, a lot of people I know are BLS instructors. Like, so they essentially teach their own classes. A lot of ACLS instructors. What else? What else? You could be an instructor for pretty much anything. You can go work at a university, which is something that I am looking to do. I actually have an offer to do that, and we're going to see how that works out. So that way I can go and I can start teaching, nursing students, in clinicals, and then every so often, go down and do checkoffs. And if they formally let me do it, then I'll go teach on the podium, as we call it. So, being in an actual classroom environment. So I actually miss being in a classroom environment where I can actually teach. So there's tons and tons of opportunities out here for you to use your nursing degree or use your nursing license, not your degree. I'm sorry. So, yeah. I appreciate everybody. I got 15 people up in here. Hey, I need everybody. All 15 of y'all to give me the 15,000 likes right now. Make it happen. Just saying. We got 2 minutes before I got to get off here. And then make sure you guys share this. Also, make sure you guys follow me on YouTube and subscribe to that, because if anybody misses this, they can go back there and they can look at it as well. So I think I'll definitely want to teach clinicals. Look, clinicals is great, right? Because that is where you get the real aspect of learning. Applying what you learned in the classroom and putting hand to patient. You can teach CNAs, LPNs. I've done that too. Yep. I loved being an instructor. Like Adrian, you weren't here, but I've been an instructor or an educator for 8 years now. So I've taught, in surgical technology. I've taught a plethora of other courses. I'm currently an instructor for TNCC. I've done curriculum rewrites for with my surgical tech program when I was there. So it just a lot. And I enjoyed it. I enjoyed it all. I enjoyed that a lot more than I thought I would. So, but there's so many other things that everybody can do out here. So, thank you. I appreciate it. So, like I said, there's so many things that you guys can do out here. Because gone are the days. Gone are the days where they tell you that you have to go work in a hospital. Obviously you have to get some type of clinical experience working in a hospital if you want to go the NP route, or if you want to go the CRNA route. Like, that's just how the cookie crumbles at that point. You know what I mean? So, but yeah, looks like we came up on 7:30. I was hanging out. Look, I hung out with y'all twice today. Y'all ain't tired of me yet? We had a fight. Oh my goodness, Lord of mercy. Also, the military bases with clinics hire through contractors. They sure do. Two big ones that are here in San Antonio are GeoMed and Vestica. I have looked at those as well. So they're always hiring nurses. As a matter of fact, the VA actually had a huge pay increase. I want to say it was the beginning of this year or last year, where they were hiring nurses, like where they needed them, and they were starting them at around $98,000 to $100,000 a year. So we got a lot going on. Go to a hospital for better pay or better management. You definitely don't go to a hospital for better pay. I can tell you that. I'm done with psych. I'm not trying to get hit. Look, I'm trying to tell you, they start swinging. Are you going to be live Wednesday? Lake, and of course I'm going to be live on Wednesday. Let me act like I'm trying to break up a fight. Yeah, okay. Yeah, VA does pay very well. Sasha, I'll see y'all later. Night. Bye, Sasha. Bye. I work in psych, and we now have to deal with COVID again. Yeah. Our ICU is starting to pick up on COVID too. Luckily for me, I don't have to deal with that. So, but anyways, I appreciate everybody for stopping by the live. Like I said, if you missed it, make sure you guys check out my YouTube channel. Make sure, if you guys aren't following me, make sure you guys follow me so you guys know when I go live. And when I go live, it's usually between 5 and 6, Monday, Wednesdays, and Fridays. I've been very consistent, y'all. Super consistent. Like for the last 3 weeks to a month. So I'm already proud of myself. So, Adrian, it was nice meeting you as well. I hope you can come by to the next one. Fatima, you're very welcome. Hope to see you at the next one. Wouldn't you need clinical experience prior to teaching? What do you mean? What do you mean, Jade? And you don't need clinical experience. You just need nursing experience to start teaching. I'm assuming that's what you meant. I just answered the question. I don't know why I told you that. So I'll be at your next one. Thanks. You're welcome. I appreciate it. Thanks for coming by. Shout out to everybody who gave me roses. Shout out to y'all for getting me to 15,000 likes. Y'all are awesome. That's what I meant. Yeah, you just need nursing experience. You don't need necessarily clinical experience. You can kind of learn how to, every nurse should know how to teach but they don't. So you'll kind of learn that as you're trying to teach students. I always enjoy watching your lives and have learned a lot. I appreciate it. I'm glad you learned a lot. This is what we're trying to do, is trying to foster that type of environment to where you can ask your questions and then not, feel like berated by people, like if you're at work or anything like that. So that's what we're all about. So like I said, I appreciate everybody for stopping by. I appreciate all the love and the support. Make sure you guys go over there and follow me on those platforms. Check out the 7-day NCLEX course if you need it, or share it with somebody who may need it. School's about to start and the semester's about to kick off. So I wish everybody the best of luck on their endeavors on doing that. So until next time, I will see you guys on the next live. Bye. Oh, Cass ain't here to fight people, so I wouldn't leave it off on. That's all we got. All right, bye.